So minimally invasive procedures have definitely found their way into the ENT field. Minimally invasive procedures have several benefits: less downtime, quicker healing, and faster results. So first, let's talk about sinusitis and nasal obstruction and what types of minimally invasive procedures are available for those commonly encountered problems. As people know, sinus infections are no fun. People that have sinus infections regularly have terrible headaches, nasal congestion, yucky green-yellow discharge coming out of the nose, and they're afflicted with these episodes regularly throughout the year. Luckily for patients, there's been some new technological advances over the past 10 years or so that involve some minimally invasive procedures to help fix the underlying cause that leads to sinusitis. Now, that begs the question, what is the underlying cause for sinus infections? For most individuals out there, the reason why they're developing all these sinus infections over and over again is because their sinus openings are too narrow. There's a pretty easy fix for that. The easiest way to fix that is to do a simple in-office balloon sinuplasty. That's a procedure during which we put you under a little bit of light sedation. We go in through the nose with some various catheters. We find those natural sinus openings and unblock them. Basically, the underlying problem is you've got blocked plumbing, and we're your plumbers to help things flow better. When it comes to nasal obstruction, there's lots of things that we can do to help folks with that. It really kind of comes down to what type of nasal obstruction the individual has. Nasal obstruction comes in two categories. There's static nasal obstruction and dynamic nasal obstruction. Now, as those terms imply, static obstructions are things that don't change with time. Dynamic obstructions are things that change as we inhale and exhale through our nose. Commonly encountered problems in that static obstruction category are deviated septums and a large turbinus. Now, what can we do to help with these things in the office? Well, let's talk about what these structures are to begin with. The septum is a midline structure that divides your nose into a right and a left side. Oftentimes, those little dividing partitions aren't straight. So what we can do is a simple in-office procedure that doesn't involve any packing at all to help straighten that septum. When the turbinates are involved in nasal obstruction, usually it's because they're enlarged. The in-office procedure that's centered around fixing that particular issue is just shrinking down the size of the turbinates. I like to call it the liposuction for the nose. So what do we do with these turbinates? We put a small little device inside the turbinate that ablates some of the underlying tissue and basically debulks them so you can breathe more freely through the nose. All right, now let's talk about dynamic nasal obstruction. Again, this is nasal obstruction that happens when we breathe through our nose. Some individuals just don't have great structural integrity to the nose. And what that looks like is every time they inhale, this little part of the center portion of their nose will tend to pinch and collapse in on itself, which makes them feel like they're not getting enough breathing, enough airflow. There's two ways that we can address that. One is we can basically implant a small internal breathe right strip. We call it a latere. It's this small little device that we tunnel underneath the skin of the nose to help support that what we call internal nasal valve that is collapsing when you're breathing in through the nose. The other method that we can do to help address that dynamic nasal obstruction is we can employ a technique known as Vivere. Vivere is this little device that comes in the form of a wand. We stick this little wand inside the nose, and what it does is it helps recontour the cartilage from the inside of the nose and also help restore some of that structural integrity that's lacking in those individuals that have that dynamic nasal obstruction. Both of those procedures are incisionless and really easy to heal from, usually take about 5 or 10 minutes. The last thing that we can help treat patients through minimally invasive techniques in our office is we can help those patients that have that chronic, yucky, runny nose. We as ENT surgeons refer to that as vasomotor rhinitis. This is inflammation in the nose that's not due to allergies, it's not due to sinus infections, it's just basically due to an overactive nose. So Clarifix is a minimally invasive technique during which we anesthetize the patient's nose and we cryoablate or freeze several targeted areas in the nose where the nerves that are responsible for nasal secretions travel. So we're basically decreasing some of the activity of those nerves, therefore decreasing that runny nose. To find out more, visit us at capitalent.com.